Good evening, you're watching The Last Word. I'm Sanjana Chauhan. Let's get right into it. There's absolutely no need to panic. Like I said, feel free to call us, ask away. The numbers are on your screen. Tonight we're actually, we have been looking at all the impact that the coronavirus has had, be it on sports, be it on normal life, what you need to do with regards to preventive measures, with regards to interacting with people, with regards to travel. But tonight we're also going to be closely having a look at the public healthcare system. We're going to try and understand whether India is equipped to handle something like this, what steps they actually need to take. And like I said, in the meanwhile, if you have any questions, we'll be taking your calls, answering your questions, and hopefully be putting you at ease. So let me quickly bring in my panelists that are joining us this evening. I have Dr. Vikas Maurya, the Additional Director and Head of Department of the Department of Pulmonology and Sleep Disorders at the Fortis Hospital. Dr. K.K. Agarwal, former President of the Indian Medical Association. Poonam Muttreja, Executive Director of Population Foundation of India. Shahid Jamil, former Group Leader of Virology, ICGEB, New Delhi, and CEO, Wellcome Trust, DBT India Alliance. Good evening to my panelists. Thank you so much for joining us this evening. Dr. Maurya, over to you first. India has a compromised health infrastructure, a high dependence on China, as we've been seeing, for medical equipment and crucial raw materials. So is the situation right now, with the WHO, of course, declaring this a pandemic, so grave that the healthcare sector can have a lasting cascading effect on other economies?
See, I think first of all, we have to understand that we also have a pandemic earlier. The last pandemic was in 2009 when the swine flu was declared, the pandemic. So, now at that time also the number of deaths were quite high. They were in lakhs. And at the moment, what we are seeing, the mortality is somewhere around between 2 to 3%, which has been seen all over the world. And if you see the infrastructure which the China has and which they raised, in few weeks, and then they were able to, contain this, and they were able to isolate the patients. They were able to, treat the patients in extra facilities. So I think if we consider about, India as well, as we have tackled earlier also. So I think when we are at the moment, we are at the contact surveillance level, we don't have so much of cases. So what we are hearing from the government is that they are creating more isolation facilities, and they will be creating more number of beds in various hospitals, both in public as well as private. So I hope that obviously our healthcare system is I mean obviously we cannot compare it with America or somewhere other countries, but I think we have a robust healthcare infrastructure in the term that our healthcare system is not as bad. It's good actually, and therefore I hope that we will be able to tackle if something like this happens, and there is an increase in the number of cases. But I think, mind you, we have only 80% of cases are mild so far. Only 20% of cases, you will require some sort of, hospital facilities, and only, 3% or so will be, out of that, only 16% will be requiring, intensive care facilities. So I think with gradually, if we have increased number of patients, then I think we should be able to, tackle such cases in our healthcare system.
All right. Okay, so, you're of the opinion that perhaps, we have the necessary infrastructure and resources. Poonam Muttreja, we actually had a guest about a week ago, when we were talking about the initial outbreak, the airport screening. He came on the show and he spoke about utter chaos at the airports, mostly because he said that the staff is either washed out or then just untrained, and they were missing passengers. We even had somebody come from Delhi, from America, and say that, they were not screened. So is it safe to also say that perhaps the coronavirus poses a risk or is overwhelming the public health sector and draining the medical workforce capacity in some way?
Absolutely, that is likely to happen, and it is happening. But I first must say that the government is making a lot of preventive and good efforts. So it's not that we don't know what to do, but yes, we don't have trained people. And second, I'm worried about the public health workers. Nobody is talking about preventing and promotive measures for them. and getting the equipment and training them to ensure that they prevent themselves. So we have to pay some attention to that. We have to train our workers, whether they are at the airports or in health facilities. Under normal circumstances, we are not conscious of infections and prevention and all these measures. And health and hygiene becomes very important at this point of time. So I think we have to do tremendous amount of management of our health force and those who are going to be doing testing. And lastly, I'd like to say that while we have the China model, as the earlier doctor very rightly mentioned, but following that with the kind of discipline China followed, India has to get really into action to put not just the protocols, but the implementation of the protocols in place. And I am worried about that. And second, I am worried that we don't have right now adequate testing. We need to do a lot more testing. In fact, we have to produce more kits, we have to train people, and testing is another way of preventing. And so I really think we need to give importance to these two.
Right. So,
aspects.
So absolutely, because that was in fact a concern I actually wanted to raise and, talk about. Shahid Jamil, the lockdown that many countries like China and Japan have instituted, is it an absolute impossibility in India, given the way our society is structured? Like Poonam was rightly pointing out, the way they have contained it, or rather are attempting to do it, is only because their society is structured in a certain way. Can we actually do something like that?
Well, we have to do it. There's no other way. If you have to reduce the spike of infections, then today the only tool available to you is social distancing, is to quarantine. You don't have a drug, you don't have a vaccine, so that's the only thing available to you, and you have to do it.
All right. So then let me understand this, Dr. KK. Okay. Poonam, I'm just going to come to you. I'm just going to take just one more reaction from Dr. KK Agarwal.
Yeah.
Dr. Agarwal, does India then perhaps need to step up when it comes to research on communicable diseases and get into vaccine production in a big way? We've seen a lot of, private healthcare sector, people coming out and say that perhaps that is the need of the hour, and that an experience like this or an outbreak like this is only going to help us, God forbid, tomorrow if something worse happens.
See, vaccine may not be an issue, may not be possible. It takes 1.5 to 2 years. Last time when SARS came, it was hit and run virus. The virus disappeared in 6 months. Therefore, no company will invest so much money for a virus which may not last in the country. Therefore, a month back, the Malaysian president, he announced a grant of over some millions of dollars, and he said, I'm contributing this. Every country should contribute. We should not be dependent on the commercial market, because these types of vaccines may not be commercially viable. And there comes the role of all the countries to pool money together and try to build up a vaccine. Even today, we don't have an antigen test. We only are measuring the RNA. We don't have a IgM test. We don't have IgG test. We don't have antibodies test. That is the first priority on us, to build up a antigen antibodies test. At this moment, vaccine doesn't look like to be a possibility, at least for the next 1.5 years.
All right. Poonam, over to you.
Yeah, I wanted to just respond to social distancing. I totally agree that is something that we must do, but that is a luxury that only some of us can indulge in. Absolutely. Or protect ourselves with. What about the people who live in chawls? What about the poor in India who are not just living on the streets, but one person in Bombay or in Delhi sharing 20 rooms, the workers in factories? How are they going to do social distancing? And again, again, people who are living in huts, even where there is land available in the villages, but there are small houses, there are small huts, 10 people living in the same house. How are you going to do social distancing there? And second, the poor, they need better food intake. And we are going to, just like the prices of masks are going up, food prices are likely to go up as it's happening all over the world. So how are we going to make sure that good food is available to those who are most vulnerable, the older people? We know that the senior citizens, the old people are the most vulnerable. How are we going to protect them? And then there are issues like we still aren't talking about. My doctor tells me vitamin C, high intake of vitamin C. Why can't we get into mass production and distribution of vitamin C and food for children and older generation, especially those who are already physically weak because due to lack of food and resources available to them? So apart from the medical side, we have to look at the social side.
Absolutely,
Yeah.
and that is something that, perhaps we really need to pay attention to simultaneously, along with, of course, like you rightly said, social distancing, because especially in a country like India, we're talking even metro cities like Mumbai, social distancing becomes particularly hard with so many people getting out on the streets, having to go to work, going to office. So all of those things. Like I said at the start of the show, we're going to be opening our call lines. So viewers, please feel free to call in. Our numbers are flashing on the screen. We have a panel of experts here to answer whatever queries and questions you may have. I have a caller now joining us from Mumbai. Rahul, good evening. Thank you so much for calling in on The Last Word. Go ahead.
Hi, I have a couple of questions.
Sure. Go ahead.
Yeah, one is I'd like to know if this virus actually spreads through sweat.
Okay.
Is that a possibility? And secondly, I'd like to know if somebody does get this virus the first time, will he develop immunity for it, or can he get it again?
Okay. Yes,
That's
pertinent
it.
questions there. Dr. Moria, would you like to take that?
Yeah, I think first of all, it's very clear. This is a respiratory virus.
Can I take it?
So
Sure,
it
Dr. Agarwal,
spreads
I'll come
through
to you for the
droplets.
second question.
You know,
Maybe
when
Dr.
you're
Moria
coughing
can take
or
the
when
first
you're
one.
sneezing, so then it spreads. Right, so it spreads through your respiratory droplets like cough or sneezing, or when you are touching the surfaces, you are coughing, then the person who's having that infection, it touches the surfaces, and then again another person comes and touch that surface, it spreads. So it doesn't spread through a sweat. That is very, very clear about it.
All right.
And the another aspect, what it is asked for.
I'm going to let Dr. Agarwal take the second part of that question. Dr. Agarwal, I believe Rahul, our caller from Mumbai, spoke about developing an immunity if one has already suffered from coronavirus or has been infected with it.
So as far as immunity is concerned, most viruses will not get a disease, but we have hepatitis C, hepatitis B virus, which become a chronicity. So there has been a debate whether this virus will develop a permanent immunity or not. If we go back to our past experiences in other corona infections, there is an evidence of a permanent immunity, whether it is SARS, whether it is MERS, or whether it is other coronaviruses. So we presume the immunity will last forever. However, WHO has also clarified that there are a couple of cases where there has been antigen has become positive again, and they feel that at that particular moment, the second antigen which was tested negative may not have been negative. But before I finish this, I also want to clarify, because when we are talking about are we prepared or not, now the data is available of the incidence of COVID-19 per million population. So if we go to per million population, it is 56 per million population in China. Maximum is 200 per million population. The average is, if we take 124 countries, the average occurrence of COVID is 16 per million population. If we take an average, in the worst scenario, India will get 20,800 cases. If we take China as a scenario that India behaves like a China, then we will end up into 72,800 cases in India. And 20% of them, that means we are talking about 4,000 to 20,000 serious cases, That should not be a problem in India to manage them, because we have more than 1 lakh hospitals. We have more than the number required as far as ICU care is concerned. Here, because India has declared an epidemic act has been enacted. So therefore, even if you get cases in rural areas, you will have to, under the Epidemic Disease Act, you will have to airlift them. And India has to prepare itself for availability of not invasive ventilators, but enough non-invasive ventilators, which are BiPAP machine, SpO2 monitors. And the only basic thing is that we should not finish our resources in milder cases. They should be preserved only for serious cases. What happened in dengue was all the hospital beds were occupied by people who never required admission, and those who required admission, beds were not available. Therefore, death rate was very high. So if we properly triage our systems, even in the worst of the situation, we should be able to manage with a mortality much lower than that of China.
All right, all right. Okay, thank you, for answering that, Dr. K.K. Agarwal and Dr. Muttreja. I have another caller joining me on the phone line, but before that, I'd like to just get in a quick word from Shahid Jamil. Shahid Jamil, we're talking, like Dr. K.K. Agarwal spoke about other infections, other diseases as well. Let me speak about those patients now. Is the coexistence of, say, other non-communicable diseases and epidemics also problematic in terms of burdening the public health sector now?
Definitely. If you see in this case, and if you analyze the mortality data coming from China, you will see that most of the deaths have been in people who are older. There are also people who have other comorbidities. So, for example, they have heart disease, they have diabetes, they have kidney disease, they have lung disease, a lot of smokers. So that's where the real death rate is. Certainly, other diseases, other underlying diseases would raise the seriousness of this infection. There's no doubt about it. Poonam also spoke about nutrition. I think nutrition is a very, very important part of it. If you raise your immune status, if you raise your immunity, you are better protected, not against just this virus, but other viruses. Dr. Agarwal spoke about numbers. I think the numbers are very general at this point. It's very difficult to extrapolate what happened in China to what might happen in India. In India, for a country of our size and our population density, we only have 73, 74 cases. Now, why is that? Do we have a different strain? Is it because of temperature? What is it? We don't know that yet. So it's really too early in the game to say anything about whether immunity will last or not last. There just hasn't been enough studies. So therefore, our only tool available, and I'll keep saying this, our only tool available right now is to not panic, be sensible, and do what the government and what the healthcare system is advising people to do.
Absolutely.
For example, people have gone out and bought masks. Every mask that you buy, you are taking one mask away from a healthcare worker who needs it far more than you do.
Correct.
So please don't go out and just grab masks. You don't need it.
Absolutely, and I don't think any of us can say this enough, as we have been saying on the channel, or even in the terms of the briefing that perhaps even the health ministry or the government has been doing, is to talk about when you actually and really need to wear a mask, and because that's really causing a fair amount of not only misinformation, but it's also causing some panic. So I'm glad that you actually touched upon that. I have another caller now joining us on the phone line, Shiv Prasad from Kolkata. Good evening. Thank you so much for calling in on Mirror Now. Go ahead.
Good evening, ma'am. I have only one question.
Sure, please.
I'm 73 years old.
Okay.
And I have COPD.
Okay.
Hello?
Yes, sir. Go ahead.
COPD. Should I always use a mask?
Okay. Dr. Muttreja, would you like to take that?
See, you have to understand, for example, as he said, that he's an elderly guy who has a COPD. COPD is a chronic obstructive pulmonary disease. right? This is just having an asthma-like symptoms, which is caused mainly because of cigarette smoking. So the issue is very very clear. If you are having a symptoms, if you are having a symptoms, for example, cough or sneeze, or then only you are going to wear the mask. Otherwise, if you are healthy, if your COPD is fine, your COPD is stable, it's controlled, I mean, you don't have to wear a mask. Only a person who is having a viral illness, those person only have to wear the mask, not a healthy person. I presume even the stable COPD patient is also healthy.
All right. Mr. Shiv Prasad, I hope that answered your question. Please take care of your health, and thank you so much for calling in on Mirror Now. Poonam, let's now look at other states and what they have done, because Kerala actually is a fine example, because with Nipah and now the coronavirus, Kerala, many are saying, is really providing a template for the center for public health problem solving. So what is it that they did, and what can the central government or any other state actually emulate when it comes to public health issues?
So Kerala, one is that they moved very quickly. So moving quickly is very important. Second, Kerala they've invested a fair amount in testing. And that's what I was saying in the very beginning. We need to do more testing. We need to, we can't just be happy saying we have only 74 detected cases, because we are not detecting, and also the preventive and promotive measures they've taken in terms of quarantine, in terms of they're prepared very much in their public health system. Ultimately, it will be the public health system. I know that the government has invited the private sector to participate and partner, and yes, they'll make 20 beds available, 10 beds available there. Ultimately, you have to really strengthen and prepare your public health system. And Kerala has done that. And and they've been talking about it also. So it is not, they haven't done anything that's not easy, that's difficult to emulate. But, and closing, I mean, the rest of the country needs to isolate people from each other, not just social distancing, but not having congregations, meetings, and so on. I mean, even today, I know in Bombay, there are development organizations, health organizations that are having meetings. We really have to declare the kind of emergency Kerala has declared.
Absolutely. So,
May I get in a word here?
Yes, sure. Go ahead.
I think it's important to understand that much of the preparedness for something like this happens in peacetime. It doesn't happen when there is an outbreak at hand. Kerala has done very well in investing in public health, in investing in primary healthcare centers that are the first level of contact with the population. I think if we have to learn anything, we have to learn from that model and emulate in the rest of the country.
True.
Sure, we are going to be putting in emergency measures now,
Right.
but the real preparedness happens during peacetime.
Correct. Because I believe that they're equipped to handle this even,
So let this be an opportunity.
Sure. Go ahead, Poonam.
Perhaps this can be an opportunity. So perhaps this can be a tragic as it is, and let this be an opportunity for us to put public health first. And I must say the country has put public health. The central government, the state governments are giving more attention than I've ever seen to public health. So let this be our opportunity, as rightly said. Let's prepare, though this is not peacetime, but let's take this as a lesson and continue and keep our eye on strengthening our public health system, so that we are not just prepared for epidemics like this, but we are prepared ongoing epidemics that do exist in our country. The whole communicable diseases, we are not able to deal with them, even on a normal course. So
Correct.
Absolutely, you're right, sir, that we should prepare, but this may not be peacetime, but let's start preparing even now.
Absolutely.
Let's
So
learn it as
a learning, a
ourselves.
harsh one, but a learning nonetheless. That's something perhaps India needs to consider. I have another caller joining me from Ahmedabad, Meenakshi Arun. Good evening, ma'am. Thank you so much for calling in on the last word. Go ahead, please.
Good evening. Good evening to all doctors. Hello.
Yes, ma'am. Go ahead, please.
Good evening.
Also, if I can just request you to turn down your television volume, please, Meenakshi ma'am.
Sure.
Thank
Sure,
you.
ma'am. Sure, ma'am. My question to the panelist in the show is, if a person gets the coronavirus and he recovers, are there chances that he may get the coronavirus again?
Okay. Dr. Agarwal, I believe we already, this is a valid concern. We
I
already took
just
this
answered
a
that.
question of this kind, but
Yeah.
please go
I
ahead.
just answered that. Chances are practically not there. WHO has already clarified that reinfection chances are not there. But we are learning every day. But as on today, chances are not there.
All right. Meenakshi, I hope that we were able to answer your question. Thank you so much for calling in on Mirror Now. Poonam, let me come back to you because like we were talking about, you were talking about all the activities, be it airlifting, screening, quarantine, treatment, taking samples, all are being done by the government right now. So, like you spoke about learning, so at this point then, is it pertinent, is it time then for the private health sector to step in considering they have the R&D capability, they have the resources needed to aid something like this?
Absolutely, but I've not seen that happen. There will be tokenism, there will be ultimately, it is about profit maximization. And I would love to be proved wrong and see a situation where the private sector steps in, not just in making beds available, but in doing, they have at their command a lot of a lot of communication information and using the mass media. They have the resources and the capability of quickly getting good programs, advertisements, behavior change communication. They can do it very quickly and put it out there in the whole country. So it's not, I mean, it shouldn't be just restricted to saying, okay, if we need beds, we will make 20 beds and 40 beds available. So one is communication. Second, they have the ability to, management ability, which I'm sorry, but our public health system to deal with something emergency like this or even the preventive measures. Our public health system doesn't deal with preventive and promotive measures at all, though it desires to in the wellness centers, but that is, we don't have the time and the liberty to do it right now. So the private sector can quickly step in giving management help to containment as well as if treatment is concerned. But prevention and promotion, especially how it's a lot of what we are hearing on this panel and outside in the WHO and other guidelines is behaving in a particular way. And that's something that mass media can be used today. It's television, radios, the government is doing its bit. When you make a phone call, it's very encouraging. You first get the message and what to do if you have a cough.
Right.
So there is, if the private sector steps in and collectively says, we are going to have a management plan for not just containment, God forbid we have many more cases, which is possible once we do the testing. And also they can organize testing across the country, but in collaboration with our public health system too. So I think there's a management structure and capability they have, which they should really put in. And then the doctors have to volunteer. Finally, which I said earlier, preparedness for the public health workers. I think we need to protect them. And large number of our public health workers are the frontline workers who are already people not in great nutritious state. The anemia amongst the women, whether you look at ASHA workers, it's quite high.
Right.
So let's have a comprehensive plan.
So, like you said, then existing hospitals, Dr. Maurya, obviously can be easily overwhelmed by a sudden spike in admissions. I mean, take a Bihar, for example. If there were to be a sudden spike in admissions for coronavirus there, it's not clear whether there are ample supplies of masks, also supplemented with the problem that Shahid Jamil actually raised, of people hoarding medical supplies, of gloves, of gowns, of drugs, of ventilators.
Yeah, I just want to make it very, very clear. If I gave you the example of pandemic of 2009 of swine flu. At that time, there were more number of deaths. There were more than lakhs and lakhs of deaths, right? And still, we were able to, even the both the public and the private, health sector were able to deal with it. At this moment also, for example, there has already been, awareness is being given in the private hospitals as well, along with the public, hospitals. Plus, the dissemination of the message of the preventive aspect is being done by the government in collaboration with. They are already sending the advisories to the the private hospitals as well as to the public hospitals. Second aspect is that how you deal with those patients. Obviously, many of the hospitals are creating the isolation. The facilities, including both as public as well as private. The only thing is that the testing facility is available only at the moment in the few selected centers. So the private hospital at the moment will not be able to do the testing, right? But yes, when the test, but they can, yes, the sample can be sent from the private hospital to the testing centers, and patient can be treated in these, the private hospital as well. As we have seen during the pandemic of swine flu also, that many of these patients, majority of these patients were treated in the private hospitals, in the private ICUs, where the ventilator, are very largely available as compared to the public health system. So I believe this time also, the utility of the private, the hospital will be will be much more, or I will say, the presence, because the presence of very critical equipments are much more widely available in the private center. So they will be able to deal with this, the pandemic. And I believe, as we have dealt earlier in the swine flu case also, this will also be dealt with in the same manner.
All right. So then would you then say the need, perhaps, Shahid Jamil, is emergency operation centers, at all levels, at the central and the state level, with special focus on states with weaker health systems? Dr. Agarwal, I'll just come to you. Let me quickly get in a word with Mr. Jamil, then I'll come to you. Shahid Jamil, go ahead.
Yes, certainly. I think coordinated action is important. You just can't be treating people in Delhi, Bombay, Bangalore. You have to really have facilities available everywhere. I would like to highlight one important point that you have not touched on so far.
Please do.
We've compared various outbreaks. We have compared swine flu. We have compared it to SARS, for example. One very key difference between SARS outbreak and this outbreak is that in 2003, there was no Facebook, there was no WhatsApp, there was no Instagram. Today, we have 2.5 billion people on Facebook. We have about 1.5 billion people on WhatsApp.
Right.
And about 330 million people on Instagram. The kind of scare that we are seeing through social media today was just missing when SARS came around.
Right.
Although SARS was a far more lethal virus than this one. So I think it's important to gear up our healthcare system and all that. But I think people should be a little sensible and try to look at things a little more logically. And not just believe in everything that people forward them on Facebook or WhatsApp.
Or WhatsApp, correct.
Yeah.
Right, and it also becomes particularly prudent, I think, even on leaders, political leaders, celebrities, government officials, to constantly disseminate the right information and really not,
absolutely.
Give any kind of ghar ke nuske, which is obviously directed at, it may be well-meaning and all for immunity, but it may not necessarily be that it's a cure. I have a caller joining me from Mumbai, but before that, Dr. Agarwal, you wanted to come in? Go ahead.
See, what I wanted to say is that at this moment, we don't want to be caught red-handed. We want to take all possible preparedness answers. Say, for example, yesterday the health minister said that we have plenty of kits. We have 1 lakh kits of testing available with us. I spoke to Sweden Medical Association. They said we have stopped doing mild cases. We are only doing serious cases because we don't have kits available. I spoke to Myanmar and they said we only have 4,000 kits, so therefore we will not be doing mild cases. Now, if I take 1 lakh cases in the protocol of India, they are doing 2 tests per person. That means today and after the treatment is complete. That means one person will require 2 tests. So therefore, 1 lakh kits basically would mean 50,000 kits, 50,000 patients. On an average, one patient has a contact with 8 people for which testing is done. That's an international experience. So therefore, for one positive case, you will be using it on 8 contacts to pick up one positive patient. Therefore, total kit requirement in India as on today is only for 7,000 infection, which is too low. So therefore, we have to work on numbers, get prepared for our, take the worst scenario and get prepared. We hope the worst scenario never comes, but we need to talk about it because once the Disease Epidemic Act is there, government has powers to take over private hospitals, government has powers to take over even hotels and convert them into hospitals. But we must learn lessons from China, Italy and Iran and must ensure that in the worst scenario, we have the lowest mortality.
Absolutely. Dr. Agarwal, thank you so much for clarifying that. We have a caller joining us. We have Gaurant joining us from Mumbai. Good evening, Gaurant. Thank you so much for calling in on the last word. Go ahead with your question, please.
Yeah, I just wanted to know, what's the constraint with getting the number of testing kits? India being such a big country, why can't we import it or manufacture it locally so we do large-scale testing in India? And second question is, if I've got cold and cough, how long can I use the mask? One mask is very expensive in India as we speak today. So is it usable throughout the day? Can I wash it and use it? Because some kind of awareness needs to be thrown on these two aspects in India.
Correct.
Because I am not aware on that.
Okay. Again, very valid questions. The first question I'm going to let Poonam take and then we can maybe go to Dr. Agarwal for the second part of your question, Gaurant.
Yeah.
Go ahead, Poonam.
Yeah, so in India, we have the capability, you're right, to make more testing kits. But in India, the problem is now to make testing kits, start manufacturing, which are not difficult to do. You need permission. So what the government has to do is on an emergency scale, in a great hurry, give permission to those who have the ability or capability, and those who don't, then the government has to find the manufacturers who can do it and give them the incentive to do it, money, whatever. But that is not a challenge. It is our rules, regulation, and the time that it takes to get permission to start producing.
Okay. Dr. Agarwal, would you like to take
that is a priority the government must.
Absolutely. Dr. Agarwal, would you like to take the second part of the question about the masks and how long?
You have Yes, I'm taking it. That as far as masks are concerned, once the Epidemic Act is enacted, it is in process, which has been done by Delhi and many, including Haryana. In that particular automatically Essential Commodities Act gets enacted. Automatically NLEM comes in and government can freeze the price. Even yesterday, surgical masks were available in many centers at 1 rupee, which is its original cost. Otherwise, it is being available at 25, which is 25 times the cost of the original. Now, as far as patients are concerned, only patients require mask. General public does not require mask. If I am infected, my mask will be provided by the government. If my contacts are there, mask will be provided by the government. All others do not need a mask. So therefore, if there is a scarcity of masks, enough education needs to be created that masks are provided to contacts and the patient by the government. All others do not need the mask. Even then, if you want to use the mask, as far as surgical mask is concerned, is to be used only once it is wet. When it is contaminated, it has to be thrown away. The N95 mask, you can clean it and can reuse it for up to 4 to 6 hours. But remember, N95 mask is not for the public. It is for the doctors and healthcare providers. Surgical mask, if you don't have a surgical mask, doesn't matter. use a simple tissue paper to use that, use a cloth to do that. But as far as patients are considered and their contacts, it's the duty of the government to provide them on a daily basis.
Right, Dr. Agarwal and Gaurant, thank you so much for calling in. I hope
May I add a word on the
yes, sure.
test?
I have other callers
Very
as well,
quickly.
but sure, Mr. Jamil, go ahead.
So you have to realize that this test is not your regular run-of-the-mill test. This test is based on the sequence, the genetic sequence of the virus. So there is a special protocol, there is a special standard, and the kits are being supplied by WHO. So it's not your regular run-of-the-mill test that you go into any lab and get it done. It requires a special training, special equipment, special everything. So it's not just a matter of manufacturing a few kits.
All right, all right. Thank you for that. Let me also quickly take some other callers that are joining us on the phone line. I have O.P. Sharma joining us on the phone line from Delhi. Good evening, Mr. Sharma. Thank you so much for joining us on the last word. Go ahead with your question, please.
Small question from the panel. Anyone from the panel, respected panel, can take it.
Sure.
There are no warnings or no stern actions being taken against any of the people who are the shops or the medicine shops, who exploit the consumers. So we need to have some kind of stern warning or some kind of action which should be evident so that they don't take any consumer for a ride. Openly, the consumers are being exploited. Anything which is costing 5 rupees, 50 rupees or 100 rupees are being charged. So government needs to do one thing in that connection. Number two, the communication part, I think, needs to be revamped. Because today I had a client, I am from the legal profession, I had a client and some query. I was informed by the minister's office that some director, I am not naming him, has recently been appointed to take and deal with this corona problem in Ministry of Health at Nirman Bhavan. Now, when I approach him, the guy is sitting coolly, cozy, and he refuses to meet, and I got guided or directed to some non-medico clerk who had no answers. So if this is the attitude or arrogance, there is no point in getting people appointed to such positions.
All right, all right. O.P. Sharma also, making quite a valid point over there, and something that perhaps I think, like I was saying at the start of the show, a panelist from last week also spoke about staff that is, maybe untrained. So perhaps it would, bode well for the government to pay attention to, staff at all levels. I have another caller joining me on the phone line. I have Krishna from Kochi. Good evening, Krishna. Thank you so much for calling in on the last word. Go ahead with your question, please.
Dr. Agarwal. Hello?
Yes, go ahead, Krishna.
Can I talk to Dr. Agarwal?
Sure.
Yes.
That we have been reporting various cases from across the country, and I am from Kerala. I think you have all appreciation for the way in which it's handled in Kerala. And there you say that there is no treatment for coronavirus and there is no medicine invented so far. But you say 17 cases in Kerala, 3 are cured. How is these 3 cured? What's the method, the medication they introduced in Kerala for curing this one? Why not apply the same thing across the country? Find out this one. And this is a very important case because they say it's cured. Hello?
All right, Dr. Agarwal?
Pardon?
So even with Kerala Medical Association, we are in touch on a daily basis. Even today, we had the Kerala Medical Association representatives. In fact, the Secretary General of Indian Medical Association is from Kerala, a past president of Kerala Medical Association. Now, Kerala had a very good surveillance system. Mild cases do not require any antivirals. Only one case in Jaipur who is a medical doctor, Italian, who developed breathlessness. There, the DCGI approved 2-drug combination anti-HIV treatment was given, and we have been told that he is doing better. At this moment, for milder cases, no treatment is required, only home quarantine is required, and observation is required. Now, definition of mild cases is cough with breathlessness along with fever with no oxygen dependency. The time they become oxygen dependent, they become serious cases. And if they are put on ventilator, then they become critical cases. The current protocol of the government is for a practitioner. Suppose if a patient comes to me with fever and cough, I will give him a anti-flu medicine. And with that, I will wait for the report of the corona. If there is a history of contact, if he classifies into any of the 4 criteria of a suspect given by the Ministry of Health, which has been a combination of a CDC and WHO, and if the test becomes positive, I discontinue anti-corona, antiviral drugs. But if the corona test is negative, I complete the flu treatment in that particular case. In milder cases, we are only observing. In serious cases, we are giving oxygen. And in critical cases, we are giving them anti-HIV drugs, antiviral drugs, antibiotics to prevent secondary infection, and ventilatory care.
All right, Krishna from Kochi, thank you so much for calling, and I hope we were able to answer your question.
Something here?
I have, okay, sure.
Can I
sure,
add
Dr. Muttreja,
here?
please go ahead.
Can I add? Yeah, I think it's very, very clear. At the moment, we don't have any vaccine and any treatment for the coronavirus.
That's right.
Those 3 cases which were cured in Kerala, they were the milder cases. And this corona is a self-limiting virus. Majority of the patient, you don't need a treatment. You just give a symptomatic treatment. And in 7 days or so, or 7, 8 patient recovers on its own. So we are not giving we don't have any anti-coronavirus treatment at the moment. So even in those patients who are serious, we are giving symptomatic treatment, for example, like, if they require oxygen or they require BiPAP or ventilator, what Dr. Agarwal said about the anti-HIV vaccine, I think these are the exceptions, these have been tried in few of the cases, but we don't know exactly whether they work or not. So at the moment, medically, we don't have any specific treatment for coronavirus. We are treating symptomatically, whether it's a milder case or a severe case or a patient requiring ICU care. That is very, very important.
All right. So, using, of course, what you're saying, Poonam, because there is no known effective treatment, like Dr. Muttreja also said, and some antiviral drugs we know are being repurposed and tested. If these are found to be effective against coronavirus, then do you feel the government perhaps issue compulsory licenses then to domestic manufacturers, and then invite foreign governments to use their right to issue compulsory license license cases, of course in a case of a national emergency, to Indian companies?
Absolutely, we should do that. And, as it was pointed out earlier, yes, I am aware that you need different protocols for manufacturing, but surely those even governments will give them to us immediately. Other governments will give us, or WHO will give us immediately. So therefore, this is the time for collaboration. There is no question, and I'm sure countries are going to collaborate with each other. But as far as symptomatic treatment is concerned, we should be very clear, because we should not give the impression that HIV drugs or anything else, as Dr. Muttreja clarified, but that is regular treatment for which we don't need protocols from anywhere else. Our doctors are very capable of doing the symptomatic treatment across the country, both in the public health and the private sector.
Okay. I have another caller. This time it's Mandar joining us from Ambernath. Good evening. Thank you so much for joining us on The Last Word. Please go ahead.
Hi, good evening. Good evening, member. I have a question. I'm a bronchitis patient, and my parents are diabetic. Also, I have pets at home, that is dogs and cats. So what are the preventive measures that I need to take so that my family members and I shouldn't get the symptoms of corona?
Okay, Dr. Jamil, would you like to take that?
I'm sorry, I didn't hear the question very well.
Okay, Mandar, just correct me if I'm wrong. I believe he said that his parents are they're diabetic, and he has pets at home as well. Mandar, are you a diabetes patient as well?
No, I'm not a diabetic patient, but I have acute bronchitis.
Acute bronchitis.
Continuous cough.
Okay,
Yeah.
so if I can get that right, sorry, your line is a little unclear. You have acute bronchitis. Your parents are diabetic. That's right?
Yes.
Okay, and you have pets at home, right?
Yeah.
All right.
Cats
Okay.
and dogs at home. So
Dr. Jamil, were you able to catch that now? Is that clear?
I will let Dr. Agarwal or Dr. Muttreja answer that question.
Okay, sure. Dr. Agarwal, over to you.
Number one is that all patients who are comorbid, they have heart disease, they have COPD, they have asthma. Number one, they must take their annual flu vaccine. They must take their regular pneumonia vaccine, because we are also talking about simultaneously of a regular pneumonia, preventable pneumonias. We know corona has no vaccine, but at least preventable pneumonias, we should be able to talk to them. That's one. Number two, remember that why mortality is high in comorbid conditions is anybody in whom any type of a low oxygen will impair or harm his body, they are going to suffer from corona. Corona causes what? Pneumonia. It causes lack of oxygen. So any anoxia. So therefore, patients with COPD, asthma, heart failure, because for them, anoxia, they will not be able to tolerate. Number two, whenever there is an infection in the body, it raises tachycardia, it increases pulmonary hypertension, therefore right heart failure gets precipitated. So increased heart rate and anoxia are the two things. Therefore, such cases needs to prevent themselves. Anybody who is 60 plus, today, till the corona epidemic is over, they should not attend public gatherings. They should talk to their doctor, intensify their medicines. And whenever they are meeting, and they should, wherever they go, they say, please don't invite us if somebody is having cough and fever. Today, wherever you go, if I go in a bus, I go in a metro, I go in a taxi, the first thing I'm supposed to ask is, I hope all the people traveling with me have no cough, have no fever. If they have, either they get down or I will not come and enter into the bus. This level of precautions are required by all people who are 50 plus. And along with that, if they have comorbid conditions, they should keep their diabetes under fully control. They should keep their blood pressure under full control. Therefore, they should consult their doctors how to prevent seriousness if I develop a COVID-19 illness.
All right, Dr. K.K. Agarwal and Mandar.
Regarding pets, what he was talking about
yes,
is
sure.
Regarding pet, he was talking about there is only one case in Hong Kong where a dog was found to have coronavirus,
yes.
Weakly positive, and WHO has clarified that this may not be an infection because the dog is still today asymptomatic. The virus may have gone to his surface by anybody who has coughed or sneezed over him. So the WHO says there is no evidence that animals can catch it or animals can give it.
That's right. So Mandar, just for you, the World Health Organization, like Dr. K.K. Agarwal said, that dogs cannot contract coronavirus, and dogs that are previously held in quarantine can now be released. Dr. Muttreja, I'm completely running out of time, but please go ahead. Last words from you.
Yeah, I just want to add, here things that, if, regarding this question, if they have not come in contact with any COVID-19 patient or they have not traveled abroad, I mean, they're not likely to going to have, or they have not come in contact of anyone having COVID-19, then they're not going to have any coronavirus-like illness. Plus, and also, as has been clarified earlier, that, right now there is a human-to-human transmission going on, and there is no any evidence to suggest that the pets will get the infection from the man or the human being. So we are completely sure that nothing going to happen in that case. Yeah.
Right. With that, I'll have to say thank you to all my panelists, Dr. Vikas Maurya, Dr. K.K. Agarwal, Poonam Muttreja, and Dr. Shah Jamil. Thank you so much for joining us tonight on The Last Word as we attempted to explain the impact that the coronavirus is going to have on the public health sector. Now, at the same time, we also know that the coronavirus, as much as a harsh learning that it's going to be, it's probably also going to be a learning nonetheless. It can be an opportunity for India to go into research, better research, step up their vaccine production, and also look at a mass supply and mass production of these drugs, which they earlier used to depend on China and Japan for. Now, thank you so much to all our viewers and especially our callers. We were hopefully able to answer all your queries and dispel any kind of misinformation or debunk any kind of myths that you felt were floating around. Thank you so much for watching The Last Word. Good night.